Yeah. Is there a camera in there?
There is, yeah.
There isn't?
There is.
This is the funkiest room I've ever seen in my life.
I know. And they don't actually cover.
It's not the room. All of this is. Of course it is.
With glass.
I know, but no show mirror. Yeah, and you got like not etched glass all the way up.
And they just shower. No, we actually slept in the next room because it was so bright. With all
Right.
I know, it's special.
It's very special to me. I'm gonna take out some more of this. It's not glass.
I'm gonna take out some of this stuff. And then, where is it going to be easiest for you to sit? Like here?
Sure.
So maybe Kim can sit there and I'll sit there, and then we'll have her in the middle. Okay. And where's Paige? I'll bring in somebody. There's some. This is a vet bed for you to sit in.
For the cat, I don't need
It's cold and hard. I'm missing a blanket. Free blanket.
No, I haven't. So. Yeah, you've experienced that.
Alright, let's see. Do we need any of that stuff? Headlamp, duct tape, gauze. There if you need it. Okay.
Where do you want me?
I think if I'm here, you would be
Here, so we just move the computer there?
Show me, just move stuff. I know my word.
Yeah, I think, yeah, so if we slide this over, because then you can see it, and then Kim can help hold the back end, and I can hold the, right? Or which way do you want?
So you should probably be
Which way do you want her head pointed?
Yeah.
I'm always best if my right hand is towards their bum. Well, for that part, that's how I do it best.
Okay.
Towards your bum, so you should be up here then, Shelly, with the head,
I'll
right?
go on this side, you go on that side.
I don't need it like
Oh,
this.
here, no, you can do that. But I like this one. Perfect. And I can put this over here.
You just move stuff.
This was a brilliant concoction. It has worked so well. I know. Yeah, because then she's takes these little hooks off the blanket and she's parade them like she's. And then I can lift off the lid. Yeah, it's brilliant. You need to patent that now. I need a few improvements though. Okay.
Do you need me to move till you get her out?
Nope. Just like here, you hold this. This is gonna be our tripod. Okay. Alright, so I'm just gonna hold on. Okay. You don't want to go for a swim. No. Pass it to me. I need my blanket. Okay. That's good. Here's on the other side. Alright. Okay, so this right here is what people are seeing, just so you know. Okay. Sorry. Like a dog that tries to do really quiet stuff. It's not very good. So we're gonna do the eye stuff first. I'm just trying to get her situated so that she's comfortable. Do you need better light? No. Oh, okay. Okay. We can't check on this side. Do you want that black blanket to go over your head when we get tent?
Oh.
Because I can't shut that one off.
We're in a hospital, so skylights.
We could probably take her into another room. Like we could do it in the bathroom.
Mm.
In the dark bathroom. To do it.
Can you check us?
Do you think
fluorescein?
we just carry her like
Like
it would be? I'd be able to do a way better job in the dark for a
Okay.
second.
All right. We're gonna go take her to a dark room, and we'll be right back.
To look at our eyes better.
Yeah, so that we can look in her eyes. All right. We're gonna go to the bathroom in the front because there are no windows there. So I'll meet you there. We're going to field trip. It's gonna be awesome.
Do you need my help in that bathroom?
You may as well come for all me.
Wow.
Okay. We'll be back.
You have a good day.
It's cold. Dr. Ferguson just examined her eyes. Do you want to explain sort of what? And you took a picture.
What we found, both her right eye and her left eye have a lot of like corneal scarring and opacity on it, probably secondary to feline herpes virus. It's been going on with her for quite a while because her body has been laying down a lot of extra epithelium, and when the body goes and tries to repair it, the reason it's so white is it doesn't lay it down as nicely as when it was first there. So I don't know if we're going to be able to save her left eye. We're going to try because we don't have really any options right now anyways, and it'll be super exciting to see if we can save that eye because we're minimally going to have, you know, her here for quite a while. And Shelly made a good point where we don't know if she's going to let Shelly put the eye medication in once the kittens come, but we'll have hopefully a few weeks before that to see if we can get some improvement. So we're going to continue with some nice safe antibiotics, and what the antibiotics do is at least take care of secondary bacterial infection while the body tries to heal that area. She will always have some degree of scarring on her cornea, but hopefully it will decrease quite a bit. If we find that her left eye is not improving or that it's a source of pain when she comes for a spay, then we'll probably do what we did with Rollins and just simply take the eye out if it's not working and it's a source of pain and discomfort for her. But at least we get a few weeks to certainly try to see what we can do. I'm going to look at the end of the ultrasound today. We're also going to try to take some blood from her for two reasons. One is we could potentially also do a feline leukemia test, which we can run at the clinic tomorrow. The other part of taking some blood is that I can take it back to the clinic and spin it down and take the serum off of the blood collection, and we can actually use some of her own body's serum as a healing eye drop for her, which would be super safe in pregnancy because we're just using her own body's repair mechanism and placing it right on the eye.
That's so cool.
We're looking into, but I need to get a hold of some pharmacologists that I know as far as maybe do we use a topical antiviral medication on there. There's not very much known about the safety in pregnancy. It may not make a big difference. It might. If she wasn't pregnant, it would be a no-brainer. But because she's pregnant, you know, I'm gonna have to do a little bit more research into that and seeing if the pros and the cons and that. So that's going to take a few days, but we're going to do what we can in the interim. And then also, so we're going to try to also take some blood. So, but we'll see if she's done by then. But she was very good for her ophthalmic exam.
And eyes are probably the most threatening part of the body to examine for a feral cat. So
yeah, because you're staring into them with a light.
Yeah. So that's good. So step 1 is done, and now we're going to attempt the ultrasound. So
Drum roll, please.
Alright, so she needs to rotate.
Keep it fixed.
And then I will get my stuff out of the way. That's right.
No,
Just
you
move
stay
my
there.
leg.
No, you stay there.
Okay, and so what we need to
There's a mouse in there.
The mouse in the house.
Alright, so what we need to do is get her rotated. Where did her head go? Oh, I think her head is here. Okay, so alright, so
Do you need to turn it
so
this
her
way?
bum is here,
Yeah, okay.
towards you.
Okay.
I'm just gonna put my phone on do not disturb so it's not buzzing. Okay, so we're gonna try to roll her this way. Get the blanket. Okay.
You should use your belly.
There we go. This is also a very vulnerable position. Let me get a scruff on her. There. See my mouth? There. She doesn't like being upside down.
Don't blame her.
Okay.
Should we try this in focus and she's get a better picture?
Yeah, I think we can. Get a little more of this blanket. Okay, good scruff and then okay.
I just have to snap them off.
Good girl, you're okay, good girl. Such a brave girl. Got some chunks.
Oh, she has a hernia.
Oh my goodness.
Yeah, you have a hernia, you monkey. That poopy. Means we'll have to fix some hernias in some kittens probably. Because hernias are hereditary.
Oh.
We're gonna try to listen to her heart too. See, she had this little
Oh,
outie.
yeah.
She has an umbilical hernia. Have you had any other kittens with umbilical hernias? Maybe she's their mom.
We have had some not orphaned ones though, I don't think. I mean, not ones without mom.
Some cute little nipples, sorry.
Just to make things a little more complicated.
Her mouth looks really good though.
These nipples definitely look like they've been used before.
they have.
That's what I was just looking at.
A little chap.
So this is a normal feral cat reaction. They shut down when they're under stress, and so that's why we're able to do this to her. It doesn't mean she's not a feral cat. She definitely is a feral cat. She's just trying to, this is a self-preservation tactic.
Warm that up. Oh, there's a dancing kitten in there. Can you see it?
That's fine.
Can you guys see it on the
Yeah.
It's on the camera, so I'm probably not.
You can loop it. Yeah, if you.
We'd have to put it up. So put it back. There was a very busy kitten. That thing back there, it's her bladder. And we go forward, and the first thing we put it on was a very happy dancing fetus.
With a spine.
With a spine, yeah.
That's the biggest one?
Oh, you can see it's kicking its back legs.
Oh.
Can you see the little legs moving?
Yeah.
Oh, there it's moving.
Oh my gosh, so cute. So cute.
I can't tell the gender. Oh, you can see the heart beating? Can you see the heart beating, you guys? See if I can get a slightly... There's the heart, better. There's the fetal heart. And you can see the other little black dot at the other end of where the heart beating. That's the bladder.
Oh.
Can you see the bladder of the fetus?
That's
The black
Near
dot.
the back there.
Yeah, near the black. And then the other one is the little heart. There's the little heart. You can see the spine, yeah.
So cute.
Okay, should we look at others? Because we don't want one. Because
One
sometimes... Yeah. I don't know if I'm going to be able to do the monitor the whole time and unless...
Yeah.
I could put one of those blocks here, actually. Sorry guys for a second. To see which is more expensive, the camera or my ultrasound.
Definitely ultrasound.
I don't know. So kind of for Shelly's hand. Because then I don't have to hold it.
Can you tilt the screen towards you a little bit so because there's people coming up and window? Perfect. Awesome.
You can see two in one picture. There's one there, and then there's one there, and you can see they're super busy.
What do you say? I can't see.
We can try to get a length. I was practicing moving or measuring, but I just honestly I don't know if I could do it on the fly like this with a ferrule. Eventually, I probably will get better.
Wow.
I would say that's like over 2 centimeters because that one's pretty scrunched up.
Mm-hmm.
If I tilt the probe in a
And
different
they have skeletons.
They do.
So that would be at least 42 days.
Yeah. It's a big. So that's in her right uterine horn bladder. Let's see how many we can see.
I'm filled up with fluids. Is her position okay?
Well, I don't know. I don't think she wants to move, which is fine. Because we're not, honestly, we would count numbers. I can give you roughly. It's always good when I get several on one screen because then we say, oh, for sure there's 3. But it's like playing baseball in there or something. Little heart. Well, there's 2 on this side for sure. 2 on her left side. You know, because there's a little skull. There's 2 in that, and that's on the left side of her uterus. And then that's 1, 2. Because this is hard. 3, I think. There's a 3rd one up there. Like that thing? Sorry, little thing, didn't mean to call you a thing. A little adorable thing. So I think there's 3 on that side. Let's go over to the right. I don't know if I can do any better than that. So this is in her right bladder again. So that's another one.
Yeah.
So that'd probably be, I would say, 4. Everybody do not hang your hat on my counting on ultrasound, okay? If even most specialists won't be able to count on an ultrasound. Never mind. And I'm far below that.
Most specialists wouldn't come and do a cat ultrasound in someone's weird bathroom. On a holiday.
Oh, I know some pretty good specialists. I want to find a friend on this side.
Oh, look at that.
Are there DC digits?
Yeah. I don't know. It's harder to get a picture because she's tilted to the left on this side. We'll look at the anatomy of the ones on the right a little better. If I can. Sorry, monkey. She says, Mom, go pee. You're squishing me. There's me, lady. That up there is her liver. There's a gallbladder.
That's good.
Right there. I'm just going forward to see, because sometimes they can get pushed up pretty high. I don't get as many on the right side. I would say 4 for sure.
I would love to have no more than 4.
I've had some breeders of like dogs, like really nice breeders, be sad when they have 10 because it's like it's too much work.
Yeah.
I think I can imagine digits, like our really developed extremities on these.
That would put us in the 50-day range.
Yeah, I think so.
Okay. That's what I guess in my brain. 45 to 50 days. But
You're good.
probably more than 51.
Like, see, way out. You understand the picture, right? Yeah.
Very clear.
But I mean, like, as far as like There's like, you can see little arms, like all the,
Yep.
because that's the head at the top.
Neat.
Okay. Cool. Well, that might be super busy.
Rolling over. Oh, come on.
So skull is like
You see two in one picture. You see the skull of the one on the left,
like ascending.
and then
right
there's
ahead.
another one. Yeah. Lovely. Yeah. To go back and compare it, like as far as on the growth chart.
Yeah.
I think 1.5 centimeters would be a really good judgment.
That looks like a bunny.
I know. It's the Easter bunny. I could look all day. Sorry. There's very soft tissue here to wipe the ultrasound off your belly. But, I mean, she doesn't have any milk, and she doesn't really look developed yet, too. Like,
I haven't seen a lot of movement on the outside.
right?
I'm hoping that we are at least another 10
Oh,
days.
I think, what do you think from how her mammary glands look?
She doesn't have a super uncomfortable waddle yet.
No, we can see her mammary glands are not really developed crazy. So I don't think we're in there last week at all. We'll go back and we'll,
hernia.
there's their umbilical hernia right there. So, which is a reasonable size actually, so we'll fix it when eventually she gets spayed. And it's a good chance some of her kittens have hernias too.
Sweet.
Excellent.
As long as they're not in the cord.
It's also really disappointing when it's the boys and they're big because
Yeah, extra surgery.
extra surgery. Girls, it's really often just extending the incision. Here you go, your belly's adorable.
So now, same position for jugular?
If we can, yeah.
Okay.
So we're going to try to get some serum from her body so that we can potentially help her eyes. I don't know how this is going to go, but...
Can you give that block to Kim and then you put that camera up on the two blocks so that they
her little face is up.
Oh, thank you. And then you tilt her down.
Tilt her down.
Perfect, thank you. Okay.
Okay, so now we're going for the next.
people watching me try to do a
I don't know. I do it in front of owners all the time, so. However, it's going to be what it's going to be.
Can we do it off? I'm just thinking if we have her better eye covered, because she can't. Can
Her
she
face
see
can be
under-
covered, yeah.
Yeah.
But we need to uncover her neck, but keep her face covered, and then she has to be as still
Let
as
me make
possible.
sure I have a couple syringe options
Okay.
before we do anything. I'll just do this in case she wants to walk across it.
She might do a high-speed walk across it.
And one of those brown ones, just in case I don't like your needles.
Yeah. Maybe those might be special.
Internet needles.
I think I have one in that blue
One of the brown.
bin.
I brought them.
I have her scruffed down here pretty good, so
that you can.
yeah, I can do one-handed.
Okay.
Sorry. Oh, here they are. Sorry.
Oh, I was sitting on them. Do you have it? Is that what you're looking for?
I'm just going to try my favorite size needle first. And then if that doesn't work, I'll use
We're
yours.
keeping her. She's going to be on her back.
She's still gonna be on her back.
Kind of side-ish.
Like this way. You can see her hernia there. Oh, she's
So,
doing very good. And
If
then
anybody's squeamish, don't
look away.
watch.
Yeah, if you don't like blood, it's not going to like be spurting blood.
No.
But it will be going into the
Into her vein. It's like how we do it. But you might have to just, yeah.
We want her on her back or on her side is fine.
I think back is not going to be good.
Keep it like, oh,
Are you
okay,
Like that. Actually, side is
Like this?
best.
Okay.
Side.
Okay.
And
I
you
can
know,
hold her
just
head.
see, so I have her under her chin like that if
Yeah.
she'll let it.
Okay.
And then she's not going to like the alcohol.
Okay.
Never stick syringes in your mouth. That's really bad for her.
That's good.
It on purpose.
Oh.
I bent it.
You're okay. You're okay.
You don't need to shave.
I don't
that, right?
usually shave, and she might.
Just get a good grip on her in case she... This is going to help you.
Yeah, it has the potential to help her, so I think it's worth the extra poke.
She's doing really good.
She is. She's
Very
amazing.
good. Oh my god, she's doing fantastic.
She's very, very good.
This is the best way to get the most blood the fastest.
With the less stress. Because you can't get as much from a leg.
Look at that. Good job.
And then we'll just hold it off for a second. So we are going to be able to make her her very own eye medication that's safe.
That's you need me to hold while you
That would be, yeah, and she can just relax a little and we'll just put a gentle pressure there. Will be her band-aid.
Good girl. What a good girl. Oh my goodness, you're such a good girl.
And we'll be able to run a feline that can eat beds.
That's awesome. That's amazing. Everybody, big hail and clap for Dr. Ferguson.
It's okay.
That was some amazing work.
If we do that again, it might not go that smooth.
That was very impressive.
And listen to her heart.
Her heart's going to be going very fast.
But it's good, so we'll be able to detect any problems.
That takes skill. In case you guys don't know that what she just did takes incredible skill. Incredible veterinary prowess.
Sounds awesome.
Yay!
She's adorable. You can come off now. She should be good.
Good girl.
Oh my gosh, you're so beautiful. I'm sorry, monkey. Do you need to put in eye drops or anything?
She's due at 4. It's not the end of the world if I gave them to her now. Or should I wait till? Then I don't have to stress her out.
No,
till
I
tonight.
think that's a great idea.
Great, let's do it. And then she's all set. She can just like relax for the rest of the day. Where did the face go? Oh my goodness. See, we didn't eat you or anything.
No. These ladies will deliver food to you on a platter.
I know, I have
Make sure your babies are safe.
She's eaten a little bit. I know, this one's, the ointment is like,
It's good.
and it just keeps coming out. And then I lose the lid somewhere. Under here. Oh no, it's a flop on your pants. This happens every single time. 3 times a day, I lose the lid when I take it off. That's how
You
good
put
I
it
am.
right here on your leg.
All right, good job, everybody. Okay, so that's everything, right? We've got blood, ultrasound, eye exam.
We did the
heart
oral
listen,
exam.
Oral exam.
Let me just gently feel her little lymph nodes.
Okay.
Okay. Just in case.
I have not taken her temperature.
We're not going to.
Because
I won't wake you.
I felt that was
Did you
one. I did. In her
That's
left
okay.
eye.
You can really see the
Yeah,
hernia
yeah.
now.
Mhm. Do you guys want to see?
You can see that hernia.
Do you want me to take a picture of that for your tiny?
Yeah, that would be good. See how it bulges? The hernia. And you push it back. And the definition of a hernia is when it sticks out and then you can reduce it, push it back, and then it sticks out again. And the reason we don't really like it, or we often want to fix it, especially when they're that side, is it has the potential for organs to be caught in there.
Which would be bad. All right, good. Thank you so much. I feel much better now about life in general.
You too.
Only 4 kitties.
Oh, don't you hold me on that number.
But at least they're healthy, and I always worry that, the stress is happening and everything. So the kittens are looking good so far.
You want me to move this out of the way to put her back?
I'll move her. Yeah, no, that'll be good. I'll just go in here. Can slide her, I think. Guess it will take me a minute. Thank you. Beautiful shower corner.
hook hold.
You had a book on hearing aid, did you want to read something now? You left that out.
Sometimes I do this.
Okay. I just have to get her blanket arranged in the right way.
Do you need to put it over your head?
No, I think I need to get, she's all kind of sideways, and I just need to get this figured out and rearranged. And the blanket needs to be tucked under. You're so brave. Let's see, because this needs to go. Oh, okay.
Now I get it.
Okay, I was like, did I do the wrong thing? Making your bed because I'm all turned around.
Oh my god.
Well, she's so smart and she's such an engineer. Actually, the other day I called her calculating, not in a bad way. Obviously. She's very smart and scientific. It's most people don't. The average person doesn't get what you guys get, you know. Brilliant idea.
It has worked pretty well. you for watching. You can learn more about her on our Facebook page at TinyKittens, and that's all. I'll do a post later on TinyKittens Facebook, and we'll post some of the pictures Kim took of her eyeball on Tiny Tapeworms on Facebook. So thanks for watching. I won't be back until her nighttime round of meds, just because she, to just give her some time to settle after her stressful, although it was actually pretty low stress compared to how it could have been, but just let her rest for as long as possible. She couldn't jump up there, because I think it's a combination she can't see very well. She's a little punchy. Step ladder for her.
Can you, I got an extra one just in case that's strange. Can you just keep this somewhere in case I ever come? Yeah. Or you need to see an eye without me? Yeah, I'll take a picture. Okay. It will last. That's a cool one.
You want to dry your hair?
Good thing I'm really not there. I thought it was a shirt off.